If I jar anything bad enough, I could rupture a vessel. So concussion is there, but the force of that concussion may have damaged the blood vessels. So you've got bleeding from that blood vessel. It depends on where that arises as to what kind of symptoms.
So would you always have one?
Where the fuck is she?
No.
Where she did?
No. Most don't
She
have
never
that.
comes to this class.
So
Yeah, you get like 3
most
points
of
every
them,
time you
most
class.
head injuries
Like
are
only
just
5
concussions. They're just bruising the brain.
That's not our
It's just what's going to be there. You'll be okay.
You
The
talk to me
symptoms
like-
will day by day get a little better, and they'll recover
You
just
have
fine.
a single class?
These are bad scenarios.
And then she
To where
also,
if it happens, the wrong angle, the wrong torque, the wrong whatever, the wrong
you don't lose a lot of points.
hour of the day, who knows? Then you
I
can
missed
damage
3 times in my
the vessel.
religion quiz.
You damage the vessel where
It's not bad.
is where the problem is.
Religion quiz.
Now there is a subarachnoid space, and that's the only natural space that's in there. That's where the cerebral spinal fluid is. And if we have bleeding into that space, because that's the level we're at, that's another one of those major problems. Because we're not going to have this high pressure on the system. It's not going to start crushing things, but we're going to end up bleeding out. So that's another one of those really bad days. But again, your ability to assess their cognitive function, assess their vitals, you'll hopefully be able to identify that something is off. Hopefully. Yes, ma'am.
I have a question. If it's like, this is actually a friend of mine right now. She got a concussion. It was her second one recently, but the first one there was no symptoms after. And it was a severe enough concussion that 2 weeks out she still couldn't. She's supposed to walk for 15 minutes to see if she's okay. She could only make it to 10 because her headache got so bad. Can't remember where classes are.
Post-concussive syndrome is very real, and where you can have symptoms. My wife, she got hit, she was a goalkeeper. She got hit in her last collegiate game by her center back. Merry Christmas. She had headaches for over a year. And we were seeing neurologists, I mean, it was, and they can't tell you anything because nothing's going to show up on a CAT scan, nothing's going to show up on an MRI. There's dysfunction in there, and it takes time and rest to kind of deal and get over. Now, each concussion can get a little bit worse, the symptoms can last a little bit longer, and they don't really understand what it takes to get that resolved or why they stay residual. But yeah, I mean, in personal experience, it's lasted a year. It is not a good day. It's not fun to deal with. My daughter, her first concussion was a ripe old age of 2. She was on a bench in our dining hall at the school we were at. Think Harry Potter, but a little bit smaller. Hogwarts, a little bit smaller. Anyways, the bench was level, and she was standing on it, so she was up to about that high, and the bench flipped out from under her, and so her head went straight into a tile floor. And once, we knew something was wrong, because, I mean, there's something about if I grab you and squeeze really hard, like, ow, that hurts. And there's something about, like, screaming because of the shock, but not really acknowledging the pain that's there. I don't know, there's something very weird and off, and so I was like, we knew she had a concussion. We watched her, she ended up going to sleep, and then she woke up an hour later and had projectile vomiting everywhere. Like, it was bad. Like, I've never been so freaked out in my life. And so you're out in central Tennessee, and you're trying to all right, so which hospital do we go to? How far can we drive, and are we getting the ambulance involved just because of the time it takes for a volunteer ambulance system to come and get you? So ultimately she had a CT scan just to make sure that the subdural and epidurals aren't there. Now that's the other catch is what do you do for imaging? If it's a concussion, nothing's going to show up, period. Not CT, not X-ray. Unless there's a fracture, X-rays aren't going to show anything. CT can show the brain. MRIs can show, we'll usually do a CT first. But unless you've got an active bleed, they're not going to see anything. So concussions themselves, rushing into the ER, unless the vitals are dropping, it's not going to change anything. They're not going to do anything. They're just going to take the money and go. But if symptoms are progressing, certainly that's when you want to have them in for sure. So I don't know. They last. Post-concussive syndrome is very real. It's very much a problem where it can just drag on. And they just need rest. All right, so the eye. Oh, what do we do with the eye? Corneal abrasions and lacerations, foreign objects such as dirt, sand, whatever. Opening and closing eyelids also becomes painful because it scratches it every time the lid kind of flops over it. Lacerations can be caused by fingernails, putting contacts in, or paper cuts. I don't know who's putting paper on their eyeball, but I imagine an errant piece kind of flies out sometimes. Anterior chamber hemorrhage. That's not okay. Yeah,
That's like a lizard.
typically want to get those things kind of looked at. I would say so. Hemorrhage into anterior chamber usually results from blood trauma to the eye. Usually stops in a few days and recovers nicely, so it's not a huge problem. But I would certainly have that checked out. I mean, we don't really want to have that kind of bleeding going in there. Now the teardrop pupil, these are bad. That's a detachment.
Teardrop pupil.
So what you've got is this. Yeah, the it's just not okay. You see the like now.
How do you get that? What's the
Well, these are all going to be like blunt force traumas in one way or another. In terms of
We
how
should
it's
talk
doing.
about this in BJ's class.
Now, there's something else that there's a scenario, and we'll talk about this in path, but there is something called coloboma, which is actually a congenital appearance this way of the teardrop eye. And so the one person will have it in one eye, not the other, and they're just that way. So again, knowing who your athletes are, knowing who your patients are, if they have this, then don't freak out when you first recognize it. Like, oh my gosh, you're gonna die! I mean, but it's not something they normally have, and it's definitely something you want to get looked at. This is the teardrop pupil is a ruptured globe, and it's a laceration of the globe itself, which causes that dysfunction. High decreased vision, hypedema, loss of anterior chamber depth. Yeah, that's bad. Ruptured globe management. If you've got any kind of injury with the eye, you typically want to cover both eyes and then get them to the hospital so that they can get the doctors in place to put them back together. Why do you cover both eyes? Because they track together. So if all of a sudden I'm like looking left and right with my uninvolved eye and it's just dragging the injured one all over the place, then that's not okay. So not so much a patch, but they want a metal shield on a ruptured globe. Something that stays off of the globe that kind of protects the outside layer, so it's not shifting around. And then they'll do a series of pretty strong antibiotics to make sure that you're not getting an infection in there. Antiemetics you don't throw out, because you don't want the Valsalva maneuver, because internal pressure here can increase the pressure, and we don't want to deal with that. And so the fix, they stitch it back together with a silicone band, and it should be okay. And you guys have recognized some of these bones, right? Dolan's lines, happy, joy. Okay, so that's a fish hook into the eye.
Holy snap.
So stabilize the hook. You don't want it moving. Brief exam to document visual acuity, pupillary response, and visual fields to make sure that, again, nervous system behind it, the globe's not ruptured. Protect the eye from further damage. Angiotetanus and IV antibiotics. Pain control. Do you don't want them to throw up the antiemetics from Valsalva, and send to ophthalmologist.
Would you like tape their eyelids open? Or how? Because I mean, if they
I might put a piece of, slide a piece of gauze or something
under.
under it, and then set the eyelid down, and then tape it in place, potentially. Just something to stabilize so it doesn't shift around. Yeah. I'd get MacGyverish on that one and kind of clean it up. So you guys do know who MacGyver is?
Yeah.
It's just, okay, this generation guy. So